Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Cortical rim nephrogram. Cortical rim nephrogram. There are different types of nephrogram. What is a nephrogram? Nephrogram is the image of the kidney. So this image of the kidney in the either in intravenous pyelogram or in kidney in kidney scans, we can call it as nephrogram. And even on the intravenous pyelogram there is two parts. On intravenous pyelography we can have nephrogram where the kidney structure is seen, and we can have pyelogram where this pelvic calyceal system is seen. Cortical rim nephrogram, that is the cortex is seen as a rim like structure like this. So this cortical rim nephrogram is seen in the following conditions. Cortical rim nephrogram is seen in acute total main renal artery occlusion, renal vein thrombosis, acute tubular necrosis, and severe chronic urinary obstruction. So, in acute total main vein renal artery occlusion or renal vein thrombosis or acute tubular necrosis or in severe chronic urinary obstruction, we can see cortical rim nephrogram. Then the second type of nephrogram is we can also have rim and ball nephrogram. This rim and ball nephrogram is seen in chronic obstructive nephropathy. In chronic obstructive nephropathy, we see rim and ball nephrogram. Rim sign. Rim sign is the cortex is seen just like a rim, because the whole of the pelvis will has caused pressure atrophy of the renal parenchyma, thus resulting in a rim of thin cortex, which is called as rim sign, which is seen in chronic hydronephrosis.
thank you and thank you for watching.